Determine the insertion length of the tube to help ensure gastric placement. Place the tube's distal end at the tip of the patient's nose or mouth for oral insertion, and then extend the tube to the earlobe, down to the xiphoid process, and then midway to the umbilicus. Note the corresponding incremental marking on the tube, or if the tube doesn't contain incremental markings, mark the tube or note an identifier at the intended exit point. Drape a fluid impermeable pad or towel over the patient's chest to protect the gown and bed linens from soiling. Lubricate the curved distal tip of the enteral feeding tube and the tube guide wire, if appropriate, with a small amount of water-soluble lubricant to ease insertion and prevent tissue injury. To advance the enteral feeding tube, insert the curved, lubricated tip into the more patent nostril and direct it along the nasal passage. Guide the tube at an angle parallel to the floor of the nasal canal, advancing it gently downward through the nasal passage toward the distal pharynx. Instruct the patient to assume a chin tuck position unless contraindicated. When the enteral feeding tube reaches the oropharynx, you will feel some resistance. Continue advancing the enteral feeding tube until you reach the predetermined length at the patient's nostril or lips. Secure the tube with a securement device, tape, or semi-permeable, transparent dressing to prevent dislodgement. Clean the patient's skin where you intend to secure the tube. For excessively oily skin, wipe the skin with an alcohol pad and allow it to dry before applying the securement device. Apply the securement device and secure the tube according to the manufacturer's instructions. Alternately, apply the tape and secure the tube, or for a small, soft tube, use a transparent semi-permeable dressing, if desired. Use protective padding under the tube, if necessary, to protect the skin from friction and pressure. Mark the tube at the patient's nares or lip with indelible marker. Measure the external tube length or note the incremental marking on the tube where it exits the patient's nose or mouth. Document the external length in the patient's medical record to obtain a baseline for comparison to assess for tube migration.